Hello and welcome. Today we're diving into a relatively uncommon but important topic, perichondritis. Specifically, we'll be focusing on perichondritis that affects the eye. We'll explore what causes it, how it develops, what the symptoms are, and how it's treated. Let's get started. So, what exactly causes perichondritis of the eye? The most frequent culprit is trauma. This could be from an injury to the eye, a surgical procedure involving the eyelids or surrounding tissues, or even something as seemingly minor as persistent rubbing. Puncture wounds, insect bites, or burns near the eye can also introduce infection. In some cases, it can arise from the spread of infection from adjacent tissues, such as a skin infection. Occasionally, the exact cause remains unknown, which we classify as idiopathic. Now, let's delve into the pathophysiology, how perichondritis actually develops. It all starts with an injury or infection affecting the perichondrium. The perichondrium is a layer of dense connective tissue that covers the cartilage, providing it with essential nutrients and support. When the perichondrium is compromised, this can lead to inflammation, reduced blood supply to the underlying cartilage, and ultimately, cartilage damage and infection. The inflammatory response triggers the release of various chemical mediators that cause swelling, redness, pain, and the potential formation of pus. If left untreated, the cartilage can necrose or die, leading to significant structural changes and deformities of the affected area around the eye. Perichondritis of the eye is considered a relatively rare condition. Precise epidemiological data is limited, but it's more commonly observed in individuals who have undergone eyelid or facial surgeries, or those who have sustained trauma to the area surrounding the eye. People with weakened immune systems, due to conditions like diabetes or immunosuppressant medications, may also be at a higher risk of developing this infection. Recognizing the signs and symptoms of perichondritis is crucial for early intervention. The most common symptoms include redness, swelling, and tenderness of the affected area, usually around the eyelids or the surrounding tissues. The skin may feel warm to the touch. Severe pain is often present, and pus or fluid drainage from the affected area is a strong indicator of infection. In more advanced cases, you might observe thickening or deformity of the tissues around the eye. If you notice any of these symptoms, seeking medical attention promptly is essential. Diagnosis of perichondritis typically involves a thorough physical examination by a healthcare professional. They will assess the area for redness, swelling, tenderness, and any signs of drainage. A medical history, including any recent injuries, surgeries, or medical conditions, will also be taken. In some cases, a sample of the drainage may be cultured to identify the specific bacteria or other microorganisms causing the infection. Imaging studies, such as a CT scan or MRI, are generally not required but may be used in severe cases to assess the extent of the infection and rule out any underlying complications. While there aren't specific classifications or types of perichondritis strictly applied to the eye, the severity of the infection can be categorized as mild, moderate, or severe based on the extent of inflammation, pain, and tissue involvement. The cause of the infection, whether it's bacterial, fungal, or due to trauma, can also influence the treatment approach. Treatment and management of perichondritis of the eye focuses on controlling the infection and reducing inflammation. This often involves a combination of approaches. Antibiotics, either oral or intravenous, are typically prescribed to combat the infection, based on the identified causative organism from the culture. Pain management is also important and can be achieved with over-the-counter or prescription pain relievers. In cases of abscess formation or significant pus accumulation, surgical drainage may be necessary. Warm compresses can help to improve blood flow and reduce inflammation. It is absolutely crucial to follow the healthcare provider's instructions closely and complete the full course of antibiotics, even if symptoms improve. Preventing perichondritis mainly involves avoiding trauma to the eye and surrounding areas. This includes taking precautions during activities that could lead to injury, such as sports or work that involves potential eye hazards. Practicing good hygiene, such as regular hand washing, can help prevent the introduction of bacteria. Following proper wound care techniques after any injury or surgery is also essential to minimize the risk of infection. For individuals with compromised immune systems, managing underlying medical conditions and avoiding potential sources of infection are crucial preventive measures. The prognosis for perichondritis of the eye is generally good with prompt and appropriate treatment. Early diagnosis and treatment can prevent further complications, such as cartilage damage and deformities. However, delayed or inadequate treatment can lead to chronic pain, structural changes, and even vision impairment in severe cases. Research is ongoing to identify more effective treatment strategies and to better understand the underlying mechanisms of the disease. Future advances may involve the use of targeted therapies that specifically address the inflammatory response and promote tissue healing. Thanks for watching.